Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, investigations of myelinosis or diagnosis of multiple sclerosis. For diagnosis of multiple sclerosis, we have McDonald's criteria. So, McDonald's criteria. According to the McDonald's criteria, it is actually regarded as the gold standard for multiple sclerosis. Then, so what are the investigations which you do for multiple sclerosis? Investigations are the best initial test is MRI is actually the best initial test, and it is also it is the best initial test and most accurate test for diagnosis of multiple sclerosis. What do you see in an MRI? In an MRI, actually you will see that there is increase in vascular permeability is the earliest feature which you see in MRI. It is the earliest event, actually it is the earliest event which occurs normally. So this increase in vascular permeability is seen as number one. First and foremost, there is Dawson's fingers can be seen. Okay, so these Dawson's fingers are seen in these will actually correspond to demyelination regions. So these will correspond to perivenous demyelination regions which are present around the ventricles. Next, there are also some lesions of anterior corpus callosum may be seen, and these lesions in the anterior corpus callosum may be specific. MRI is also used to show the relapse. If there is any relapse in the MRI, you can see has multiple white matter hypodense lesions. So in the MRI, in multiple sclerosis is seen as multiple white matter hypodense lesions, especially if it is new lesions occur, then it is said to be that there is relapse in the um, multiple sclerosis. Then evoked responses can also be calculated. These evoked responses, actually they will detect the evoked responses will detect slowed or absent conduction. They will detect slowed or absent conduction in visual, auditory, or somatosensory or motor pathways. So whether the pathways are conducting properly or not can be checked with the help of these evoked potentials. Then we have to do a CSF examination. On microscopic examination of CSF, you will see that there is mononuclear pleocytosis is seen. Mononuclear pleocytosis is seen where there is increased mononuclear cells are seen with total leukocyte count usually less than 20 per cubic millimeter, and there is also increased IgG levels are also seen, and we will also see that there is increased oligoclonal bands are also found to be increased to be around 85%. 85% increase in oligoclonal bands are also seen in on the CSF.
thank you and thank you for watching.